This video shows insertion and removal techniques for the Mackool capsule retractors. I'm Dr. Richard Mackool. Also, we'll demonstrate some little tips. So this is a pig eye, a cloudy cornea, for demonstration techniques. That's a 2.4 millimeter clear corneal incision, and that's a beveled side port incision. So normally when you need these retractors, set the location of the first one right in between the side port incision and the primary clear corneal incision. And that's a side port blade that will make with a vertical incision. That's an important note. Notice that I'm going in vertically. So I've got two of them 180 degrees apart, and just slightly enlarge it as I come out so that the internal aspect is about the same size as the external aspect, which we'll demonstrate. Now, that I made a little too large in this pig eye, but even in a human, that would be expected to seal. So here's the fourth one. So now there's the typical four. And you want to place these things, these 1.2 millimeter, that's what the base of this side port blade happens to be. You want to place these incisions perpendicular to each other. Now, this is the wagon wheel container, and you can see you get 5 of the capsule retractors, and you just rotate the clear plastic cover to expose the 5 retractors. And this is a serrated, often referred to as a clot forceps. And the best way to handle these is with 2 of them. Now, the grip is reasonably secure with serrated forceps, not with smooth forceps. It's quite mobile in them. But even in a serrated forceps, they are a bit mobile. So I'll regrasp this here, and I'll show you that by just pushing a little, it'll rotate some. But that's okay. That's doable. So by using 2 of the serrated forceps, kind of hand over hand and get a good positioning, and want to aim the point of the hook, in other words, the angle part, right at the incision. And then you can use your second one to help you. And you notice it's parallel to the incision. That'll make it go in the easiest. And then as you push it in, the orientation of the retractor, hard to see it through this cloudy cornea, but it's as it was going in, it's parallel, the retractor, to the anterior capsule. It's not pointed down at it. And you can just leave it like that and put in all 4 of them, which is what I'm going to do here. Or you can, one by one, as you put them in, hook the edge of the capsule erectus. Now, it bears emphasizing here that we normally, with a diffusely lax zonule, will put 1 of them in every 90 degrees. But if there's an area of absent zonule, or areas, we'll put 1 in every 45 degrees there to get additional support. And I've used as many as 7 of these in cases with literally no zonule and gotten to it. Now notice there I couldn't get in, so I'm showing this as a good one. So I'm using a spatula. I was in the wrong spot. So with the spatula, you can easily find the location of the incision, and sometimes it's hard to see these little punctures. So that little spatula trick is a nice one to locate it. And once you know where it is, then you can go right at it and slip in the individual retractor right there. Okay, so remember, each one of these retractors, when you hook the capsule erectus, they're designed not to really retract it or pull on it, but just to gently kind of approximate the capsule so it stays where it is when you slide the stopper all the way down. Now at the end, to remove it, you just lift up on that stopper and get the retractor oriented horizontally again. And now you can just snap it out. And that's a common way to do it. But there's another way. You can use an instrument like a Coogan hook and just insert it to the primary incision, reach across the eye, and then grab the hook as shown there, right in the angulation of the tip, and then just pull it across the eye and pull it out the incision. You can do that easily with the 3 retractors that aren't adjacent immediately to the incision. The one adjacent to the incision, you can pull it out too, but you have to really loosen the stopper and push it far into the eye so you can get at it, and then pull it out. So you've got 2 different ways to do it. Now you might think the Kugel hook is a little less traumatic, because when you pull out an angled hook, well, you're going to hit some of the endothelium here, and you might lose a fraction of the cells that are there. I've never seen any even localized corneal edema from these. So there it is, the technique that I prefer to use, with some tips for using the Mackool capsule retractors.